Hardy Swann, and you're with the TheSwannsNest podcast. Today we are joined by Katie Thom.
Hello, I'm Katie.
Hi, Katie.
Thanks for having me.
I'm so excited for you to be here because I really wanted you to talk today about your experiences, and you have such a unique experience. But I would like for you to start a little bit with just kind of telling us about yourself.
Sure. So I'm Katie. I'm a BCaBA, which is a board certified assistant behavior analyst. I've been working with Swann Clinic for almost 3 years, I think. Yeah, it's been an amazing experience. And yeah, just kind of enjoying the process of learning and growing and
All the things.
all the things. Yep.
What's the difference between a BCaBA and a BCBA?
Good question. So BCaBA is the bachelor's level of the behavior analyst, and then BCBA is the master's level.
But you've been in master's level courses, right?
I've been in master's level courses. I just finished a couple months ago. I finished my fieldwork hours, and I'm testing soon, hopefully, to get my BCBA.
Is there a specific name for the test?
The BCBA exam.
There you go.
Yeah, pretty straightforward.
Is that stressful?
It's a little stressful, yeah. But it's been, a year and a half now on my mind, so it's gotten less stressful just knowing that's what's coming.
The inevitability of it all.
Yeah.
That's awesome. And so you take your coursework. Did you do like a full course sequence, or like what does that look like?
So there are different options, and all of the information's on the BACB's website if anybody's interested. But so the pathway that I took was I went to Florida Institute of Technology in their online master's program. So you do all of the behavior analytic coursework along the way while earning your master's degree. You can also have your master's degree first and then do the course sequence, which is just the behavior analytic courses, but
which is what I'm gonna do.
Which is what you're doing. Yep. So there's a few different routes to get your BCBA certification.
Cool.
But, yeah.
Yeah. How did you get into the field?
Gosh, I've been in the field for about 10 years now. I first started in the Denver area as an RBT. I just saw a job posting and I was like, I like kids. This sounds fun.
Yeah.
And I have my bachelor's in psychology. So I was like, I knew I wanted to do something in the field with kiddos. And as soon as I started, I just knew it's so interesting to me and I love everything about it. So my supervisor there suggested starting coursework.
That's awesome. Mm-hmm. And did you go through FIT for your BCaBA?
Yep.
Nice.
Yep.
How was that experience?
It was great. It was like the first time ever in my experience in the educational world of just knowing that this is exactly what I'm interested in and what I want to do. Like, loved every bit of it, and it all made sense to me. So I was like, I'm on the right path.
Nice.
Yeah, which is, I feel grateful for that.
Validating feeling.
Has that experience.
Yeah. No, for sure. And then when you came, I remember meeting you first time. Mm-hmm. And when you came to work with us, like what was your goal?
My goal was, so I took a break for a couple of years. We can get to that later, or we can get to it now. But essentially when I moved back to Colorado and I missed being in this field, and I wanted to learn more and continue in the field of behavior analysis. So coming back, I wanted to start my coursework towards my master's and just keep learning more.
Tell us about the break.
Okay. So I've been learning Spanish for the Spanish language for 6 years. When I first started my interest sparked from traveling, and I just loved the sound of the language. I wanted to get to know the people, and be able to communicate with them. So I started studying when I was working as an RBT and getting my BCaBA. Mm-hmm. And then one day the thought occurred to me, like, I love traveling. I love speaking this language and learning more about it. And I also love this field of behavior analysis. How can I combine all of these things together? And I knew in order to really get a good grasp of the language that I needed to move somewhere to practice it, because otherwise, if I wasn't immersed, I wasn't going to make myself do it. Mm-hmm. So my partner and I took the leap, and we moved to Mexico, and we found a little corner in this community that we loved, and we stayed there for 2 years. And I got to practice Spanish and really become more fluent in it.
Immerse yourself.
Yeah. And then while I was there, I happened upon, I still had this passion to learn more about behavior analysis and work with the autistic population. And I found that this little town happened to have an autism center. It was actually in April, so Autism Awareness Month. They posted this banner randomly. I was driving down the road and I was like, there's an autism center here.
Yes.
It was, yeah. And so I reached out to them and I volunteered there for a couple of months. And it just reinforced in me that, like, I mean, autistic people are everywhere. And, you know, the field of behavior analysis is also widespread and can help everywhere, but it's so developed in the US and not so developed in other parts of the world. So yeah, I, you know, started making these goals to combine all of my passions, and that means, you know, working with the Latino populations and Spanish speaking population and helping use my knowledge in behavior analysis there too.
That's amazing. And I bet that language piece is sort of like the hurdle.
Yes. Yeah.
Because you learn everything in English. And let's be fair, the way that things are like labeled in ABA, the like names of things, it's not very friendly.
No, there's already a barrier in the English language between behavior analytic jargon and just everyday language. And then to translate that into a whole other language, it's been a journey, but it's...
Even just the word consequence.
Yeah.
Like...
Right.
Yeah.
It takes a lot of... And actually, it's been great practice for me because it takes a lot of bringing it back to, you know, everyday language and having to, like, this is the word for it, but this is what it really means. And while I'm doing parent trainings in Spanish, that's the most important piece of it, is being able to explain, here's what this term means in your everyday life with your kiddo.
Yeah. That nuance of that, like, behavior analytic language in Spanish has got to be tough. And even like when Daniela and I and Ellie were doing feedbacks for our evaluations, like, you know, coming up with a word of like atypical development, like that's like, how do you say this?
Yeah.
Like,
yes. Very, it gets complicated.
Splinter skills.
Right. Yes. Yes. I'm not ashamed to say that there are times I have to look up how to say certain things because
very grateful for
so much. Yeah, me too.
Yeah. Well, and then it's like regionally specific too sometimes.
Yep.
So we have like a lot of friends here from like the Chihuahua area, and then we have friends from like Puerto Vallarta and like just all over Mexico.
Yeah, and even like El Salvador and other parts of Central America and
Guatemala. Yeah.
Words for things.
So that's a challenge.
It is. It's a good challenge. It keeps me occupied for sure.
It's like your brain needed more.
Yeah. Never bored.
Never bored. I love that. And so then here, like at Swann, you've been able to get like a lot of exposure to being able to do those activities and do parent training in Spanish. And
yes, I've had so much opportunity that I'm incredibly grateful for through this position. Not only just learning, the behavior analytics side of it and getting that supervision, but having, the practice to get to do parent trainings in both languages and, doing that translation, the three-way translation between everyday language to behavior analytic jargon to how do you say this in Spanish? And it's just, it's been incredible practice.
And we have technicians, and then like Hector is there too. So I'm sure you like lean on them.
Yes. Oh my gosh. I can't tell you the amount of times that I've said, how do you say this one? Is this the right way? Like, am I saying this correctly? Like, how would you say this to a parent versus the child versus the technician? And
I think that it's so cool because you got this idea and this trajectory of like what you've wanted to do. And so you have a space, and there's like a structure set up in Mexico for you to go there and apply your knowledge. Are there challenges with like licensure or anything like that over there?
Yes, from the research I've done so far. So the BCaBA, which is the governing board that most people use in the United States, doesn't actually cover Mexico.
Right.
But there is an international certification you can get, which I plan to get after this one, that does cover. It's just a little less developed, and I know a little bit less about it. Obviously, that I need to learn more about it. There's also not, as much developed funding, so figuring out how to get funding for it is a challenge as well. And then the supervision piece too, because it's not so developed. I foresee that I'll need to do some sort of telehealth supervision I want to find, Mexican BCBAs. There are some. I've searched it on the board. I want to reach out to them and, have that cultural piece too, because that's a huge part of it.
Huge part of it. Oh, that's exactly what I was thinking about talking about next, because I'm like, okay, so like there's this transition and this shift. Most people who are coming into this field, like that's not something that they need to consider. How has the culture impacted the way that you render services or informed it?
Yeah. It's a really great question.
Because our culture here in Rifle is like, it's pretty specific. Like this, like down valley culture is specific.
Yeah. I mean, I think it, it affects the way I work, and just, I mean, it's taught me to, like, everything is individual, you have to be flexible and, use what you know, but also apply this person's own experience and their culture and their family. And that has to have an effect on our treatment too, especially when it comes to parent training and, looping the family in and taking their values into account to their kiddos' treatment and, the goals we work on. And is this actually something that you care about and that you will use? Because if not, why would we work on it if it's not important to you?
Yeah. And I think because treatment can be so individualized, like opens you up to be able to put culture at the forefront of what you're considering.
Yes.
Because I know our Latino families, like it's never in isolation. The parents are always like, the families are living very collectivistically compared to like how our Caucasian families live.
Yeah, right. That's a big piece to take into account too.
So you have aunts and uncles and grandparents and like everyone's involved.
Yes, so there might be multiple caregivers, and sometimes that maybe they only see them once a week, but they're this big part of their life, and they take them to go do this activity, and we might not always get the chance to communicate with them and teach them the stuff we're working on too. So then it's checking in with the caregiver who's in for parent training, and like, how can I help you to pass this on to everybody else in the family too? And then like also always making sure they know that anyone's welcome. Like it's an open door. If this cousin is curious and wants to learn how to work on this certain goal, they're more than welcome to join a parent training or schedule a separate one, or just trying to have the open communication and relationship with the families and asking them what's important to them and what works for them.
I think that's one of the things I love about like parent training is that it's really driven by the parents. Like, tell me what's going on, what you need. How can I help support you?
Yep.
What are your goals?
And it might change weekly. This week I saw this. Like, oh, I'd planned to talk about this, but this is what's important right now. Let's shift gears. Yeah.
And how do you, like, I'm just interested from your experience, what is your understanding of how autism and neurodiversity and services and treatment look like within our culture here, like within the Latino culture in where we live?
Like, can you repeat it? Sorry.
Yeah, sure. So like our families around here, our Latino families, like how have you noticed anything different about the way that they understand autism or neurodiversity, or what like interventions should look like?
Honestly, not really. I think in terms of, these families, when you get a diagnosis, I mean, I'm sure culture has a piece of it, and I can't speak for the Latino culture.
Right.
So I don't know what everybody's, thoughts are beforehand, but I think for every family that receives this diagnosis, it might be a different reaction.
So just in talking about like the differences we've seen, and I think that your experience is so great because I think there are other people who probably don't know this opportunity exists and haven't even considered this as a potential choice in their practice. So like just talking about the differences in like parent training or like access to service and things like that when we're talking about servicing our Latino population and community members, what kind of differences have you noticed in those spaces?
Yeah. I mean, just the fact that we, in the US, this is the common route once you get a diagnosis, that like this, it's recognized that this therapy is And the evidence is there that it's useful and helpful, and we have the funding and it's available, and that's not something that's happening in, at least in the town that I was in Mexico. It's just not. The ladies that were working at that autism center were teachers that noticed, their learners who learn differently and need more, and they opened it all on their own and did their own research on how to help. They were learning things from Facebook groups, just doing the best that they could and
accessing the resources they had.
Yeah. And so just the fact that we have this so much help available here, I think, I can't speak for the Latino families we work with, but I'm sure if they have families, family members in other parts of the world, I'm sure it's something that I know it's different, like the resources that are available here.
And we were talking earlier that it's like autism, it's whether or not the perception of it is correct or the understanding of what is autism and what does it look like is correct. In the United States, at least, this has been such a well-known thing. It's becoming more known. Yes. And that's not necessarily the case in Mexico.
Yes. Yeah, there's definitely, from my experience, there's more acceptance here and awareness. And, ABA has had some mistakes in the past. We're improving as a field, in my opinion, and we're understanding you don't need to change the person. Let's just change the environment and help them, live the most independent and safe lives, and happy lives that they can. And I think there's still, parts of the world that are a little behind on that, and they just, there's just less awareness around it is all.
Yeah. So I think, I love your experience. I love your journey. Look, obviously we love us some Katie Thom. We love us some Katie Thom. And I'm so appreciative of you sharing those skills and being part of what we have been able to accomplish here, and especially for increasing access to our Spanish-speaking families, our Latino families, that you and I talked about it in the beginning, that is very important to our mission here.
Yeah. And it's been a two-way street. I'm so grateful for the opportunity to get to know these families too, and to make a difference in their lives. And I hope it's been helpful for them,
and just to run parent trainings and write programs and just be a part of that trainee experience. I hope you've enjoyed it.
I've loved it.
Yeah. So transitioning into independent practice, what are your kind of manageable goals that you have for yourself in that first year?
Sure. Just being flexible with myself and
grace,
open to all the experience. And I know it's going to be a fairly difficult journey navigating not only moving out of such a supportive environment that I've had here at Swann Clinic, but into a whole different country and a different culture. My goals are to continue, learning, and I plan to do that through reaching out and networking and finding people in the culture that are certified and can supervise me, because I need that. I think the direction I'm moving in is just getting immersed back into that community, getting to know people, meeting people who are already sort of in the field. So I know there's there's a speech therapist I saw that's in that town. So, getting, contacting them, because collaborating with other professionals is huge too.
Huge.
Reaching back out to that autism clinic, just kind of putting myself out there and getting to know some people before jumping in and trying to start something, because, it's their community.
It's their community.
I'm a visitor. I just want to see where can I fit in to help, and what can I do? So I want to have, open goals, I guess. I don't have anything specific, because I just kind of want to see what's needed.
I love that.
Yeah.
Ask them if they need a Swann Clinic South.
Yes.
No, I love this. I think this is amazing. Katie, I'm so excited for you to realize your dreams, watch this come true, into fruition, all of your hard work just paying off. But if there's something that we can do to help support even from far away, I want to be there.
We'll open a clinic in.
I'm telling you. Why not?
You'll be hearing from me. I'm going to be calling with questions.
Good.
Yeah.
Good. I love that. Well, thanks, Katie, for being here today.
Yeah, thanks for
Good luck with everything.
Thank you.